Good morning, everyone. My name is Barbara Link, and I'm with Superior Health Quality Alliance. I would like to welcome you to today's COVID-19 All Settings Sharing Call. We are, can everyone hear me okay? Just want to give me a thumbs up? Okay, great. Thank you. We're very excited today to have a first session of our two-part series with Doctors Without Borders, and I will introduce them in just a moment. We have a few housekeeping items that we'd like to talk about beforehand, and then we will get started with our presentation for today. And today's presentation is a full hour long. We will not break out into individual state sessions as we have in the past, just because this is quite a information-filled session, and we're very excited to have the presenters with us today. So just want to let people know about a few upcoming events. We have the National Nursing Home Training Series, Managing Staff and Challenges. That will be today at 4 o'clock, and Elena will be putting a link in the chat if you'd like to register for that. We're very excited about that. It's also at 3 Central. And then our next session for Doctors Without Borders will be on July 23rd at 10 o'clock, 9 Central Time. That will focus on emotional well-being in the time of COVID-19. For the month of July and August, we will be having 2 sessions of this all setting sharing call due to the summer months. And so we will not have a session on Thursday, July 16th this month. And also, please, we always have our evaluation posted in chat, so we want to know how we're doing. Please take advantage of that. And also, we will be having a polling question too. We have some different topics that people have completed on the evaluation. And so we would like to have you rank order those as to what your interest is. Please check off the top 3 of those topics, but we're always open to other topics as well. If you don't see a topic there in our polling question, please fill out the evaluation, and we certainly will consider that topic for a future session. Okay, Elena. So I just wanted to also provide an opportunity for everyone joining the call today. Superior Health Quality Alliance is currently asking partners to join our quality improvement efforts through our contract through CMS. And so we're very excited. We wanted to provide you an overview of that opportunity today. So Superior Health Quality Alliance was formed in 2018 with 8 healthcare organizations across 6 states. We are broadening our national CMS quality improvement efforts, and our goal is to collaboratively improve quality of health and healthcare for consumers, patients, clinicians, organizations, and communities that we serve across the 6 states. If you'd like to move on to the next slide. So our first initiative focuses on the nursing home setting as well as community coalition development. So within the nursing home task, we're focusing on improving healthcare for nursing home residents. And within the community coalition task, we're focusing on improving the healthcare across the continuum of care for all settings and patients that reside in the community and their health care. So there are 2 unique opportunities. We're very excited to extend this to all of our participants today. And so, Elena, if you'd like to move on to the next slide, we'll talk a little bit about the area of focus. So we have 5 bold strategic aims that we're focusing on for this quality initiative. And that's to increase the quality of care transitions for all patients who are Medicare fee-for-service, as well as those who have Medicare. So that's focused on CMS And the other quality initiative is increasing patient safety, as well as increasing chronic disease prevention and self-care specific to the primary care setting. We also are improving, as noted before, nursing home quality of care for all residents living in nursing homes, and then improving behavioral health outcomes for those Medicare beneficiaries living in the community, as well as decreasing opioid misuse and prescribing. So how we're going to implement that is through a 3-tiered approach. We have an independent implementation strategy for those settings that are very self-motivated, and we would be providing a toolkit of information for them based on those 5 strategies that I just covered. We have affinity groups that provide webinars and ability to interact with your peers on those specific topics. And then the last one is more of a structured collaborative, where it's a much more intensive approach, where if people are familiar with that ECHO model, where there would be a subject matter expert and then real-time learning and intensive growth in targeted at the 5 strategies below. So we're quite excited about this. If you'd like to learn more or are interested in joining today, Elena will put that link in the chat, and then we will have one of our quality improvement experts reach out to you to talk about how you could engage further. Sometimes maybe even your particular agency or administrative office is already joined, and we can let you know that you're already involved and make sure that you get the information on an ongoing basis. But also it's just easy to join, and then we'll have one of our quality improvement experts reach out to you to talk to you more about how we'll be moving forward with these initiatives. So we're very excited about this. Currently, we're targeting the 3 states of Michigan, Wisconsin, and Minnesota. But as we move along to our other quality initiatives targeted at skilled nursing homes and hospital settings, as well as as well as primary care settings, we'll also be enrolling people as well. So we're very excited about all of our initiatives, and please join today, and then we'll reach out to you and provide you even more information. Okay, with that, we will move on. So just wanting you to know that all of our sessions are recorded, and so we do not want you to disclose any personal health information of any of the patients that you're helping. Please keep it generic if you have a question in that arena. Please mute yourself while the presenters are speaking, and if you would like to ask a question, you certainly can unmute yourself, or you could also put that in the chat. But when you unmute yourself and have a question, we appreciate you stating your name, the state that you're from, and your organization. If you are participating by phone today and not by video, then you would press *6 to unmute yourself by phone. And then Elena always monitors the chat and can re-say the question if someone has chatted in for our presenters today. If you have any other questions or comments, please chat them in, but we do want you to know that this is recorded, and we do always send out the link afterwards with any resources that we talked about from this session or past sessions, as well as the link to the recording of today's session. Okay. And let's see, is it moving forward? I still see the welcome. Anything else? Okay. So now I will introduce our presenters for today. We are very excited to have Heather Pagano and Dr. Buffy Lloyd-Creechy from Doctors Without Borders. They will present on an overview of lessons learned from the front line, an international perspective, as well as a perspective here in the States. They have been working in skilled nursing facilities in the state of Michigan, as well as some other states regarding COVID-19. And at this point, this is the first session, and then on July 23rd, we will be talking about dealing with some of the frontline workers and strategies for stress management and some of the things that they've been working through regarding that at our next session on July 23rd. But today we will be providing information on infection control and COVID-19, and I will turn it over to Heather and Dr. Buffy now. Thank you so much. We just really appreciate you and your time today.
Good morning, everyone, and thank you so much, Barbara, for the wonderful introduction and for having us here today. We're very grateful for the opportunity to speak with you all. So as mentioned, my name is Heather. I'm the emergency coordinator here for Doctors Without Borders in Michigan. I'm originally from St. Louis, but I've been working with Doctors Without Borders for 12 years. And in this webinar, we'll do a short introduction to ourselves and the organization. I'll do a short bit on our global programming for COVID-19 and some of the main findings and lessons learned that we've seen so far from our programs in nursing homes, not just here in the US, but in Europe and in the Americas more broadly. And then Buffy will do a longer presentation on some IPC best practices and technical tips and tricks after that. Next slide, please. So Doctors Without Borders. Next, please. There we go. So we work in about 50, we've been around for about 50 years. We work in around 70 countries. We typically work in conflict zones, in natural disasters, but also epidemics like Ebola, cholera. And we've been doing this for many years. And so we've been supporting our own hospitals with increased infection control. And all of our services are free of charge, and we are independently funded thanks to the generosity of our donors, so that we're able to go abroad and do this work. So we run hospitals, vaccination campaigns, and provide technical advice and support, which is what we're doing here today. Next, please. Oh, went a little bit too far. Yeah. So next is fine. Next. So we have some animations. So this is a map showing our global operations for COVID-19, as well as our regular programming. So we had to, of course, prepare our existing hospitals across our projects around the world for COVID, prepared in terms of infection control, but also in terms of preparing to treat patients and all of this. So that's a map of our worldwide programming. However, we did open brand new projects as well, particularly in Europe, and the US, where we're not usually working, and with also a rather unusual program for long-term care facilities. So this is the first time that we've worked in nursing homes at this extent, and now we're here in Michigan doing a 3-month assignment, trying to bring some of this added value, we hope, in this really extraordinary time, in a moment of solidarity with our fellow healthcare colleagues. So our activities in long-term care facilities typically have these 3 parts. So we start with an IPC site assessment in a home, and really the added value is that we want to be in person with the facility to be able to tailor recommendations directly to them, so that it's not virtual, it's not another phone call, that it's really able to help facilities go through all of these guidelines that you're getting and drowning in from the federal level, the state level, but how can you practically implement them whenever you're already so busy with everything COVID has brought to these facilities? So we do a site assessment, and this typically looks a little bit like the ICAR from CDC, and then we write a report after with some tailored recommendations, short and to the point. Then we can provide some technical on-site support and training. Buffy's going to talk specifically about what that looks like. And then finally, we also offer these staff well-being and mental health workshops. That will be form part of the introduction to this in our next session with Superior in 2 weeks' time. Go ahead, please. So this is quite a busy slide, but I wanted to show it because I think it's important to show that this is not just an American issue. So this is all the different things that you know better than me that have happened to nursing homes in COVID-19. So you had this increased workload, little outbreak preparedness, inadequate infection control. These are all issues that existed and have been problematic due to not having funding, resources, time. And COVID just came along and really made it all much worse. And then there was the added pressure of trying to protect the second line, so protect hospitals, but then that that just added increased workload to nursing homes and made them into makeshift hospitals, but maybe without the necessary support and resources in place to do so. So this whole slide is actually from our Belgian project. And I wanted to show it because this is not just an American problem. This is something that we saw also in Europe. And all of these factors came together in a mix that brought extra cases. We had twice the workload with half the staff, and it was a really, really difficult time. And what we saw and what we've tried to help with in the projects we've been running is this in-person support, because we also saw in other contexts, but it's particularly the case in the US, the system is very punitive. So it's regulators who show up and give citations and this sort of thing, instead of maybe actually bringing the resources and in-person support that's needed to cope in these extraordinary circumstances. Hospitals couldn't cope with COVID. How can we have expected long-term care facilities that have chronic problems with funding and staffing shortages to do so? It wasn't fair, and it's not fair to punish them either. So this is a little bit the bigger picture, and what we've tried to do is create a package to support nursing home facilities. And with that, I will hand over to my colleague Buffy, who will give some examples of what that looks like in practice. Thank you.
Thanks, Heather. Thank you so much, everybody, for having us today, and thank you to Superior Health. I just want to add a plug to the QIO program and encourage you to sign up with your local QIO if you haven't already. Having worked with a prior QIO and a few years ago, I know the absolute value of working with your QIO and the resources and technical support that they provide. So if you haven't signed up, today's the day to do it. So I'm super honored to be able to have worked with Doctors Without Borders in the Detroit area. They called me Dr. Buffy, the COVID Slayer, and this was pretty fitting. I'm a little outrageous, and I get pretty excited to go into working in nursing homes. This is my colleague Shannon giving a presentation. And it was such an honor. I actually live in Arizona. I have my own infection control business, actually specifically working for nursing homes, as I've seen just such the great need across the country. And when I got the call that Doctors Without Borders was in Detroit, I really leapt at the opportunity because I believe in the work so much and their philosophy and what they're trying to do, and the advocacy is so important. So it's been a great honor to be able to work alongside with Doctors Without Borders and support your facilities in the Michigan, Detroit region. So what I want to talk about today is really some infection prevention and control, best practices, lessons learned, and really some actionable items that you can take today and begin implementing today within your healthcare setting that can not only prevent infections such as COVID, but also if you have COVID within your facility, that can help prevent the spread of it. So I hope that this presentation will be practical for you, will provide resources that you can then pull up later and be able to utilize as you continue to work and navigate through your infection control program. The first thing I want to talk about is the IPC facility-wide assessment. This is the ICAR. Many of you are familiar with this already. If you need the link, you can search long-term care COVID ICAR. This is a great tool. I also recommend using the 2016 CDC ICAR. It's a little bit different, but what's really important about using any assessment tool within your facility, especially for somebody that's new to infection control. So if you have an infection preventionist that's new and has just started, this is a great tool for them. It's like a checklist, and they can actually use the checklist and identify the areas that they're strong in and the areas that they may have challenges. So I recommend being able to utilize this ICAR assessment within your infection control program. Print it out, use it, and also regularly, maybe once or twice a year, go through it. The COVID one is specific, but again, there is the one for the 2016 ICAR as well that has more infection control practices in general domain. The other resource I wanted to provide to you today was the CMS survey resources. We want to make sure that everything, Doctors Without Borders is not we're not aligned, or we don't work for CMS, but we want to make sure that you know that we're aligned with all of the guidelines and requirements and regulations. And I find this to be a really great resource that you can go to the survey resources, and that way you know exactly what your state surveyors are looking for when they come into your facility. Not that our motivation should be that we pass our state survey, but it helps to align and make sure that everything that we're doing within our facilities meets the regulations. So this is a good resource. I recommend being able to download this. What's also very helpful is any updates that CMS provides. Sometimes they get lost and they're hard to find, and they're always in here. So the updated guidelines you'll be able to find. I want to talk a little bit about COVID cohorting. We know right now in that different states are experiencing different stages of COVID. And one of the things that we identified early on is that it's really important to have a strong cohorting program. So there's different types of cohorting. You have, if you have COVID positive residents, the patients under investigation, any admissions or readmissions or medical appointments, and then residents that are refusing testing. These are the categories that we want to do for cohorting. The COVID positive, we want to make sure that any residents that have tested positive, whether they're asymptomatic or symptomatic, that they're placed on this unit. The patient under investigation are in a different area, that because we don't know if they're positive or not, so we don't want to mix them in with the COVID positive. The area that we've seen challenging is those that are admissions or readmissions or have medical appointments. And as the project in Detroit, Doctors Without Borders project going into the nursing homes, as we've seen it over the weeks expand, this is the one area that we've seen a decrease in compliance. And staff aren't really sure who's on isolation and quarantine and who's not. So the current recommendation is that any resident that is a new admission or readmission or is frequently going to medical appointments such as dialysis, that they're placed on a 14-day quarantine under droplet and contact precautions. And really this needs to be very well communicated to the staff. And the best way to do this is making sure, you can see in the second picture here that they have the signage on the door as well as the PPE bin outside. This is a great way to communicate with the staff, especially the housekeepers and the CNAs and anybody that may be coming into your facility that normally doesn't, maybe a consultant or a provider, that they know that this resident is also on a quarantine isolation. And so what we have found is that this is the one practice that's getting a little bit lax, and the staff are a bit confused. So it may benefit you today to go and ask your staff if they're aware of who's on quarantine and who's not, and if what proper PPE is required for those on quarantine. The other thing, these other pictures I want to demonstrate. The first one is this: if it's possible for your COVID unit to have a separate entrance from outside, that's helpful, so that it's more blocked off. If you can block off that special unit where there's no entry anywhere else except outside, if you have that's a great process. Or if they can come in and out one way, it's a good process. Also, if you have, I wanted to show this picture, the third and fourth picture with the face shields. It's important to be able to hang the face shields, or if you're using reusable gowns, to be able to hang them up. You want to label the hooks so that the staff know exactly whose the equipment is and who's, how to reuse it, making sure after they're cleaned and disinfected. Always hand hygiene is our go-to. You would think that people are done talking about hand hygiene. We always talk about hand hygiene, but it's important to have a brief few moments to discuss it. It is the one area where I often see the greatest lack of compliance. I want to a little bit of confusion. The CDC does recommend and state that hand sanitizer is the preferred method for washing hands in most clinical situations. And so you wouldn't use hand sanitizer if your hands were soiled or if you had other specific infections such as C. difficile or norovirus. You want to follow the protocols for appropriate hand washing with those types of infections or those types of clinical situations. But the reason I bring this up is because having hand sanitizer available to all of the staff is really critical and important in making sure that you have a good supply and that the staff are actually compliant with this. So it is recommended to have a hand sanitizer outside of every resident room. The CDC actually recommends outside of every room and inside of every room. However, if that's not possible, then to have it outside of every resident room. And I know that there is concern with the fire marshal, but having it outside of every room does meet your requirements for that. And if you really wanted for the hand hygiene, you really want to take the human element out of it. You want to have it to where people don't have to think about it. So if it's there, they're going to use it. And having the philosophy of gel in and gel out, just as we do in the hospital. So the more access we have, the easier it is to do, and then the more we are compliant and protecting not only ourselves, but our residents and our environment. And of course, here's the WHO hand washing and hand rubbing infographics that are available. Most people have these up in their facilities. We see this often, so this is great. This is just an example of a facility that doesn't have the hand sanitizer outside of the rooms, and so it's recommended that you are able to add these dispensers to your facility. And also, we do know that most vendors will provide these hand sanitizer dispensers for free because then you're purchasing their products. And so ask your vendors, hey, is this something you can provide to us? This is really important, and I know that the state surveyors are beginning to really look for this, and that's our auditing. They want to make sure that we're actually auditing these practices. And as you go through the ICAR and you go through even the new CMS audit tool, you'll see that almost every domain of infection control, such as hand hygiene and PPE, transmission-based precautions, every single domain is now asking, are you doing frequent auditings? Are you teaching? Are you educating? And so this is a great audit tool. It actually is from the ICAR from 2016, as I mentioned a few slides back, and the link is available there at the bottom of the slide. And you can utilize this audit tool to conduct your audits. And so you can just go through, kind of be that secret shopper, see who's doing hand hygiene before and after coming in and out of the resident rooms, before and after resident contact, and also before and after glove use. I just want to state that the way to use this specific tool, because there can be some confusion, is one row would be one opportunity. So for example, say you have an RN is the staff type, they go into the room, and then so that would be room entry would be the one opportunity, and then you would indicate what they used as far as alcohol rub, hand wash, and so forth. So this is a great way to really track and identify how hand hygiene is going within your facility. COVID signage is really important, and this is one area that we have found that has been a gap is this proper signage. It's really important for your staff to know what they're encountering and what the residents' needs are. So the sign on the left, the special droplet contact precautions, is for those residents that are the new admissions, those that are coming in and out for appointments, those that are on that 14-day quarantine. And this one also has 2 other pages associated with it that actually describe proper donning and doffing, which is great. Also, The one on the right is for COVID specific. So it'd be really good to utilize this signage so that it's very clear and your staff know exactly what type of resident they're caring for. So I have seen that, like, for example, I asked the housekeeper once to show me how she responds differently to a COVID positive room, and she literally just walked right in without any PPE on or anything. And so just having this clear signage makes it helpful to your staff. Some face mask do's and don'ts. I'm sure everybody is experiencing this and seeing this. And first of all, if you get bored and your staff, you guys want to play a game, you can play the ineffective face mask bingo. So this is a great infographic of what not to do for your face masks. And as we see, probably the most that we're seeing is the feedback where the mask is below the nose or even hanging around the neck, the chin strap. So it's really important that we continue to educate the proper use of the mask. And here's a great slide. This is new. I actually found it yesterday on CDC website. It's face mask do's and don'ts. And I would recommend printing this and hanging it and having it available for your staff. It's great. It actually describes how to wear the mask and then what not to do, and then the proper way to remove the mask. This is one area that can really, just by implementing this today and discussing with your healthcare workers and those that are working in your facility, how important it is that they don't touch the outside of their mask, because the outside of their mask we want to always consider it contaminated. And so if they're touching the outside of their mask and then they're touching themselves or touching the resident, then they could be potentially contaminating themselves or the environment. So it's really important that we educate them to use hand sanitizer before if they need to adjust their mask, because we know that people need to adjust their mask all the time. And then once they've done adjusting their mask or removing their mask, that they do hand sanitizing as well. It's important to discuss transmission-based precautions. As we are all aware, this has been a really challenging time for us to have appropriate PPE. We know that the supply chain, luckily, is getting more available. The gowns are becoming more available, the masks. And so this is another great way to indicate. You can see the picture on the left. They've got that nice bin on the outside. For every single resident that is on any type of transmission-based precautions, always have this bin on the outside. It's the first indicator that staff have that, oh, this room is different and we need to do something different. Another recommendation is making sure you have a plan for restocking. So this is one area that frequently I see that these bins are empty. And so it's beneficial to actually ask your staff who's in charge of restocking, and maybe having that assigned so that they know exactly who's supposed to do it and what shift they're supposed to do it. That way, anytime you need to go in the room, then you have what you need. I've heard staff tell me before that they don't have time to go look for it, and so they just go in and they do what they need to do and come out. So we don't want our staff to not be protected, and as well as our visitors once we start having visitors again. So making sure that this is always stocked is really important. And then also making sure that we have a place for appropriate donning of the PPE. That should be that should be inside of the resident room, and making that available for all of the people that are doffing their PPE. I want to talk today a little bit about environmental services. This has become really near and dear to my heart because I see it as the greatest opportunity of improvement for infection prevention and control in long-term care. And these staff are amazing, and they don't often have the appropriate PPE. Their practices can contaminate the environment. They And it's important to make sure that they have the IPC training, the proper cleaning and disinfectant products, as well as the supplies that they need. So here's an example of a cart that you can see. This is what not to do. You can see the goggles are next to the toilet bowl container that they would clean the toilet with. You can see the dirty mop bucket and water. This is a pretty extreme example, but it's not totally uncommon. I just want to put that out there. And so if there's anything you can do today is go check your housekeeping carts and identify that they have everything that they need on those carts, that they have, and that it's clean and not going to contaminate them or their residents. And here's an example of a cart that, you know, has what they need. They have the bag for linen and trash. They have, or for trash, I'm sorry. They have the gloves available, and everything is neat and contained. It's really important to make sure that our housekeepers have the supplies that they need and that they're well protected and that they're not forgotten. This is what I recommend is the train the trainer model for PPE and environmental services. And here you see on the left, I'm demonstrating to Miss Phyllis. She's my new best friend, and demonstrating proper hand hygiene and proper glove usage. And then I have her model this as well for me after. So she does the hand hygiene and putting on the gloves. And this is really important, not just for me to demonstrate it, but for them to demonstrate what they've learned. And the reason being is because it sticks in their mind longer, the way they do that. And I was able to visit Miss Phyllis about a week later, and realizing that she was still doing the same practices, and then, you know, just continuing to reinforce that is really important. Also, it's important to provide that training for putting on the gown and the gloves and the face shields and the mask in the proper order. And having them demonstrate it is really important, because they watch you, but then it's like, oh, wait, what order do I put it on? Do I put my gloves on first? Do I put my gown on? So it's helpful when you actually have them do it as well. Supplies are really important, and we want to make sure that all the housekeeping supplies are provided and that they're in a safe place. Many facilities will use the dispensers, such as you see here at the bottom, and just making sure those are regularly maintained by the manufacturer. I have seen outbreaks before where these dispensers have been broke and nobody was aware of it. So just taking a look at your utility closets and making sure that they're clean and organized is really important. And I want to go through very quickly, you know, cleaning versus disinfection. It's the cleaning is the physical removal of any of the dirt, and the disinfection is the actual destroying of the pathogen. What's important to note for the environmental services is what the kill time or dwell time is. Many of these products take 10 minutes to actually be effective against the virus. And so it's important to understand what that dwell time is. And then the proper implementation of cleaning a room. So you wouldn't believe how many people actually do this backwards. And the proper way to actually clean the resident room is that you start with emptying the trashes, you clean all horizontal surfaces, then the vertical surfaces, you sweep and mop the floor. What I like to tell people is just going in that clockwise or counterclockwise manner, and always making sure to clean from high to low and clean to dirty. And we want to encourage the housekeepers to clean the resident rooms first, and then the restrooms to prevent any potential cross-contamination. The restrooms, we want to stock the supplies, empty the trash. We want to clean the sink and tub, the horizontal surfaces first, and then the vertical, and clean the toilet and sweep and mop the floors. Oftentimes in the restrooms, the housekeepers, they think they want to tackle the dirtiest first, so they're cleaning the toilet, then they're cleaning everything else. And we want to help reverse that order and clean from the cleanest or the least dirtiest to the dirtiest. And again, making sure that help prevent the cross-contamination. Cleaning and disinfection products, really important, making sure they're EPA registered, and also making sure that the staff have the appropriate towels, that they have at least 2 to 3 towels per resident room and at least 1 to 2 towels per restroom. And it is recommended to have those towels soaking in the solution, and that will help making sure it's like creating your own Sandy wipes. So it helps to make sure that then you are able to have the product appropriately on the surface for the dwell time. Here's the EPA N list for COVID-19. This is a great way that you can just look up your products that you have. If it's on here, then you know that it is effective against COVID. If it's not on here, then you may want to call the manufacturer, and that sounds a little intimidating, but believe it or not, sometimes it's just 1 or 2 people that are sitting in an office. And because sometimes the product is registered under a different name and that it actually is effective against COVID. So if it's not on the list, it doesn't mean that it's not appropriate. It might be labeled under a different manufacturing name. Here are some cleaning checklists that can be utilized and for daily cleaning as well as terminal cleaning. Many of you are aware of these, so these are beneficial. Just quickly, I want to go through linen. It's important to make sure that our linen is appropriately separated, and that you have in your laundry room a separation from the clean to the dirty. You want to make sure that you have the PPE available for the staff who is sorting through the dirty linen. That's really, really important to keep them protected. Also, you want to make sure that the linen is covered. And the question I have for all of you today is, how often are those covers cleaned and or replaced if needed? So, they get touched all day long, and it's a good question to ask, how often are they being disinfected and cleaned? So that might be a good question to take back to your facility today. Food services is really important. Briefly, I'll talk about that. It is a source of ongoing transmission of infections. We know that. It is really important that your food service workers are wearing their masks and that they cover the mouth and nose at all times. We know it gets hot in the kitchen, and so if they need to remove it at times, that's fine. But we want to make sure that they always put it back on to protect the environment that they're working in, and that they don't touch the masks as we described. Obviously, if the mask gets soiled, then they should throw it away and get a new mask. Especially in that kitchen, it can get really hot. You want to also just making sure that if the staff, as always, if they have any type of diarrhea, vomiting, that they are excluded. We know that other infections, foodborne illnesses, norovirus is often spread through food services. So you want to make sure that the staff are well aware of their policy for calling in if they're sick and staying home if they don't feel well. And then always cleaning and sanitizing the kitchen and dining areas with the EPA approved product. It's really important. So finally, I want to talk about just some health education. What is how are you doing with your weekly testing for healthcare workers? We know that now in the Detroit area and around Michigan that certain nursing homes are testing weekly for their healthcare staff. And we get a lot of questions about that. We hear things like, this is ridiculous, we don't need it. And so providing that education to the staff about the appropriateness of the testing and how it really does help keep COVID at bay, and helping to know exactly where your rates are within your facility to protect the workers as well as the residents, as well as when it's indicated for residents. So we know that one case of COVID is considered an outbreak. And so depending on your facility and your requirements, you may have to test all of your residents if you have one positive. And then providing that staff the education is critical to really helping support them. We find that the buildings that are the most successful in this current pandemic are those that have strong leadership, have strong team commitment, that are communicating well and working close together. And providing the staff that education is critical to helping them know exactly what's going on in their facility, why you're doing what you're doing, and to help them feel supported. It's not easy day in and day out. I totally understand that. Wearing the PPE all day long is challenging, caring for the sick residents. And so we just want to continue to support the staff and bring that education to them as well. Briefly, I just want to mention there is this with the weekly testing that's occurring. We know that there is what's known as persistent positive, and this is those residents or healthcare staff that may continually test positive. And there is information on the CDC regarding this persistent positive that's occurring. So I encourage you to look that up and identify what that, it really means that somebody that has tested even negative at one point, then can still test positive. Just means that some of the viral RNA is still left in the body, and that a person may continue to test positive over and over again. And you wouldn't want to put that person on isolation or require that healthcare worker to stay home. So that's another important indication when we're frequently testing. Finally, I want to always encourage those new IPs that there is training. The CDC has the free IPC training. APIC, as well as the Nursing Home Association, also have training available for a low cost. But if you are that new infection preventionist or need a refresher, this is definitely available for you for training. And I'm sorry I went a bit over my time, but there's so much to talk about. We could have this conversation for hours. So I hope that was helpful, and we will take questions at this time.
I did have one question come in, Dr. Buffy. It was regarding some of the information you provided in the beginning of your presentation regarding quarantining of the residents. And the person asked, on the CDC COCA call a few weeks ago, they said that residents who go out for dialysis do not need to be quarantined for 14 days so long as the PPE guidelines are adhered to before, during, and after dialysis. Has this changed?
So I was not aware of that. So if that's the current requirement or the current guidelines, then yeah, definitely stay with what the CDC has recommended. So this was prior to that. So good information to know, and I'll definitely look that up as well. So just with that in mind, you want to be very careful, because we know that the way COVID is coming into the nursing homes, it's not from the residents there themselves, because they're not leaving the facility, but anybody that's leaving the facility and coming back. So not only do you really want to make sure, if you're not going to put them on a 14-day quarantine, then making sure that they have the appropriate PPE, the mask, and that they have the mask on, as well as the driver, making sure the driver has appropriate PPE, and then also identify the way that the vehicle is being cleaned and disinfected. So these are really important things to consider as we're bringing people in and out of the facility, because we don't want to inadvertently expose, have somebody expose the rest of the facility based on somebody that's going to medical appointments. So that's really the biggest criteria, is just identifying that process for infection control.
Hi, Heather and Dr. Buffy. This is Julie. Thank you again for working with our nursing homes. We're very grateful. Our partners, Minnesota and Wisconsin, we have very similar demographics. So we're certain that this information applies to their nursing homes as well. So thanks for sharing. Have someone that you wanted to introduce the work that they've done in their home? Do you have that person available today?
I'm not sure if, David, if you've joined the call, if you could unmute yourself. I'm not sure that he actually was able to join. Yeah, I don't think he was able to join today.
I actually see him in the call. I don't know if he's able. That would be, Elena, that would be David Camelli.
Yes.
Yeah, I don't see David. Might have joined by phone, and there are a few phone lines as well. Not able to unmute.
David, if you're able to enter in chat what your phone line is, then we can get you taken.
Oh, that would be fantastic.
We're seeing him now. Let's see.
It might be if his computer doesn't have a microphone. There we go. Now I should be able to unmute him.
In the interim, we do have a question in chat. How is trash being handled for PUI and known COVID positive?
That's an excellent question, and I get that question a lot. And according to the CDC,
do you hear me?
Oh, go ahead. Yep, go ahead, David. We'll answer the question after.
Hello, do you hear me?
Mm-hmm. Yes.
We hear you.
Yes, we can hear you.
Okay, I cannot hear myself. Okay. I can't hear anybody.
Well, let's see. Can you hear us? Can you hear me? No? Okay. Let's see.
I cannot hear from you guys. No.
Or I just message David that we can hear.
Mm-hmm. Okay.
Hello, Hello, can you hear me?
Mm-hmm. Yes. Yes.
So I can hear from you guys. So what I'm gonna say is about Buffy. Buffy and her team came to Polycare, and what we identify mostly is the stuff that we've been doing daily and becoming a routine that we don't recognize as a part of the infection control. And the problem that we saw from Buffy, because when Buffy and the team, Doctors Without Borders, came to our facilities, they look in a different angle, whereby we just assume everything was going the way it's supposed to be. But when we had the second high, that's where the identification, like cleaning, how the cleaning is done, and Buffy already went through. And what we realize is a lot of things were falling under the crack. Employees are not doing what was supposed to be doing it. And one of the challenges too was the short staffing. The short staffing, having 3 employees to work 3 floors made it another challenges too. We had, a lot of employees quitting when the COVID pandemic hit our facility. And the community too as Detroit, as a region. So when we ran short, at one point we were really short-staffed that, sometimes I end up working on housekeeping. DON end up working as an aide. And those are the challenges that we encounter, getting employees. And then another problem that came to is during the move, because we had to do the isolation. And that is where we had challenges too, because those residents has to be moved, isolated from the residents that were negative. Given a short period of time, moving and cleaning the rooms became challenges that we encounter, including the short staffing, not only in housekeeping, also in nursing, also in nurses' aid. Those were the things that we went through. There was a time that I was here with the DON until past 1 o'clock, and we were here early, implementing the CDC guidelines. We have to move, we have to create the COVID unit, and those are the challenges. And also another thing that, I would like to appreciate from the Doctors Without Borders is having to talk with the residents, and staff, giving them reassurance, during the time of grief and the panic that we went through, giving the assurance that, this is how it goes, we got to protect ourselves, you got to wear this, because some of them, were afraid that, I'm going to catch COVID, I'm going to get sick, I have a young one at home, and that is, across the board. Even myself at one point, my wife is an RN in the hospital. And at one point, I had a feeling that I don't even need to go home because I have two little young ones. I have my parents who are prone to the COVID, like, they have underlying. And I just, I could get out of work and I don't feel like going home. My wife, it was the same thing, coming home and it's like, I don't know what to do with this. At one point I had to tell her, like, you quit the job and I'll be the only one that, that go. But is that gonna help? No. So those are the things that, that we encounter. The thing that I see is the training more often. We had a video that for 8 minutes that Dr. Buffy gave it to us, that we showed the housekeeping stuff, and also as well, we show also the other stuff like CNA and nurses, because the cleanliness does not only stop with environmental service. What I see myself is it goes beyond the housekeeping, because touching and all those things, getting out of the room, those are the things that can be controlled by housekeeping, by the aides or the aides or the nurses or any other staff that comes to the facility. Okay. Unfortunately, I can't hear you guys. I can't hear you. Okay. All right. Thank you. That's all I have it.
Thank you so much, David.
Thank you very much. We'll do sign language. I don't know. Thank you. We only have about 2 more minutes, and we did have a few more questions in chat. I don't know if we can go a little bit over today, just a few minutes. And then if we don't get to everyone's question, we will certainly have those answers in the resource directory afterwards. Elena, would you like to at least see how long we can go here with a few of the questions?
Yeah, do we want to go back to the one about how trash is being handled for PUI and known COVID positive?
Yes, absolutely. So the question is that it actually doesn't have to be, it's no different than your regular trash, actually. It doesn't have to be considered, it's not biohazard unless it's truly biohazard with blood or bodily fluids, and it can be disposed of the same way. So that was a question that many people had early on during this pandemic, and we checked with the, we checked with CDC, we checked with OSHA, and it does not require any special treatment other than it's considered contaminated just as any other trash is and should be handled the same way.
Thank you.
The next question is, could you speak to best practices allowing hospice patients / residents who have dementia and their families being able to see each other?
Yeah, this is a challenge, and from my perspective, we have I didn't really do a lot of this. This came more from our wellness or stress management. And so I don't know if Heather, you can speak to that more, but as far as infection control, I don't have really probably the best answer. I know that they've used the iPads, and some people have even been able to, like, outside of the windows, but it's definitely very challenging with not being able to come into the facilities for sure.
Indeed, it's a super complicated and difficult question, and we'll address that in the mental health webinar we'll be doing in 2 weeks. Our psychologists also put together a 2-pager for when facilities start to reopen and how to safely try to meet each other as family members, if you will, because that will take some getting used to and new ways and tips and tricks about how to do that safely. So in 2 weeks, we'll come back to that one.
Thank you.
The next question is, other than short staffing, what other areas have been identified that are impacting the disparity in Wayne County? Will your assessment identify and assist in identifying those areas?
So good question. So it's I'm not sure I totally get it. So disparities due to short staffing is super complicated. There are structural issues in terms of disproportionate impact on communities of color, for instance, which is a systemic problem across the United States that is quite pronounced also in the Detroit area. But the assessment isn't designed for that as such. It's, as Buffy said, the really practical details and kind of small changes that can make a big impact. And what we've seen is that often most of the trainings or in services that are available in nursing homes tend to just focus on the nursing staff. And they tend to leave out the housekeeping staff, the EVS, the kitchen cleaners, even the CNAs sometimes. And we all know how close of a connection and contacts actually they have with patients. So a part of the project that we run are these trainings for non-clinical staff. And I think that's something really important to put into place in these facilities. We've got some materials. And we can give you some materials for that as well at the end for how to conduct some of those trainings, because the key bit is this. You can't, to affect proper behavior change, you can't just tell people what to do. You have to explain why they need to do it. And so there needs to be a short explanation for the virus, how it's transmitted, and more importantly, the opportunity for people to ask questions, especially not in front of their clinical nursing peers. A lot of non-clinical staff feel embarrassed to ask questions in front of their other colleagues. So it's important to give them extra attention.
I think there's just one last one, if we have a couple seconds for one last question. How do you provide training and oversight to ensure consistent implementation of IC practices while short-staffed?
I can take this one. What I really recommend, in the one thing that I identify quickly in these facilities are champions. So it's important to have, say, a housekeeper champion. And as David had described with Qualicare, when I was working with their housekeepers, I found one that was really engaged and who was able to, I knew that he would be willing to share the best practices with the other staff, because even like we're not there all the time and the training is, limited. So just finding those people that are more engaged and asking them to really champion infection control practices. And this will help support when you're short-staffed, as well as staff turnover is really important. And, just making sure that they really can rally the other workers together. And then, it is a challenge when you're short-staffed. And so, having just that those champions there are helpful to making sure that the practices are consistently implemented. And then one other thing is, again, to make sure they have the supplies, making sure the staff have the supplies they need, like making sure they have the hand sanitizer available, the towels available, making sure that they have the PPE, and so that the last thing that they need to do is run around and look for the supplies that they need.
Thank you so much. That was the last question that was in the chat.
So even though we just went a few minutes over, which is still pretty impressive, we really appreciate Dr. Buffy and Heather being here today. We look forward to the second session on stress management and frontline workers for our next session. We'll be dealing with quite a few things, from patient engagement along to how the frontline workers can deal with some of the stressful situations that they're dealing with in their unique situations at our next session on the 23rd.